This is a community analysis of Carrollwood by Ryan Ward. The origins of Carrollwood were that it was settled in the 1800s by John Leonard, Caroline Bond, and Enoch Metcalf. Initially, it was named Lake Magdalen after the Native American interpreter that traveled with Leonard, Bond, and Metcalf. There were only two main thoroughfares, one north and south, and the other east and west. Carrollwood only had a population of 70 people, one post office, and two schoolhouses before 1900. Citrus crop farming was the primary source of income in this then considered rural community. The evolution of Carrollwood is the current population is over 33,000 people. There are 7 schools and 3 post offices. The simple one-lane dirt roads off of the 1800s have evolved into highways with as many as 3 lanes in each direction, with even more expansion anticipated. Primary resources of income are service jobs, science and arts, as well as sales and office. The community structure. Benefits of the community structure are centrally located businesses, adequately placed emergency assistance, easy access to evacuation routes, a variety of conveniently located grocery stores, numerous restaurants with a wide range of prices, multiple forms of transportation are available for those with and without medical needs. The issues related to the community structure are the noise and lighting from close proximity to businesses with extended hours, impaired drivers leaving centrally located restaurants. Less expensive food options are not typically as centrally located as the higher end ones. The population issues. Limited resources for a low-income population, no designated government housing available, infrequent food pantry events, large number of high-priced grocery stores. The nutrition concerns, close proximity to restaurants, availability of food delivery. The health-related resources are many primary care services are adequately placed, urgent care services are available, centrally located hospitals, elderly services are available for those in need. Many specialty services are available, such as OBGYN and orthopedics, as well as many mental health care facilities. There are well-placed pharmacies throughout Carrollwood. The community objectives I chose were family planning, which increased the proportion of females in need of publicly supported contraceptive services and supplies who receive those services and supplies. The statistics I found were that 53.8% of females in need of publicly supported contraceptive services reported receiving those services and supplies. Sleep health. Increased the proportion of adults who get sufficient sleep. 69.6% of adults got sufficient sleep, which is defined as 8 or more hours for those aged 18 to 21 years and 7 or more hours for those aged 22 years and over, on average during a 24-hour period. The food safety. With all of the restaurants, both fast food and sit-down dining, the increased proportion of full-service restaurants where food displayed or stored hot are held at the proper temperature. 60.2% of full-service restaurants were compliant with hot foods that are held at the proper temperature. Political functionality. For access, Carrollwood is regulated by the City of Tampa government as well as Hillsborough County. Meetings are held regularly in which the public is welcome to attend. Attendance. Attendance to public meetings is recorded and approved beforehand by online applications. One area for concern is the assistance for low-income families, which has been scattered throughout this presentation as one of the major difficulties in Carrollwood. Community needs. The first is resources for residents below the poverty line. 11% of the population in Carrollwood is below the poverty line. There are no medical resources in Carrollwood with income-driven billing. There are no designated low-income housing developments inside Carrollwood. After-school care for children and adolescents. Schools offer aftercare programs at rates of $150 to $400 each month. There are currently 7 schools in Carrollwood and very few low-cost options. The third is increased activity levels in children at school. One reason is loss of recess is used as a punishment. Child obesity rates are high. 4 is ban smoking in public areas. Secondhand smoke enters through doorways when smokers are within close proximity. 5 is provide free screening for chronic diseases for residents with risk factors. Many members of the community are affected by disease, which could be minimized by early detection. 6 is ensure proper safety measures are taken in construction sites. Construction sites remain dangerous even when not actively operating. Poor safety measures could create hazard within the community.